Our hearts beat 3 billion times before we die, creating enough energy to drive a truck to the moon and back. It's the hardest working muscle in the human body, and did you know the less sleep you have, the greater your risk of heart attack? It's one of a number of unexpected heart attack triggers which doctors want us to know about. Let's have a health check now with Dr. Tamara Hunter. Hi, Dr. Hunter.
Hi, Tracy.
How common are heart attacks?
Well, a heart attack is otherwise known as an acute myocardial infarction. It's a life-threatening event and happens because a blood vessel that supplies the heart itself gets blocked, meaning there's a lack of oxygen, and so that damages the heart and then ultimately its function. Around about 400,000 Australians have been affected by heart attacks. Some 54,000 Australians each year suffer a heart attack. That's 1 every 10 minutes. And 23 Australians lose their lives every single day in Australia due to heart attack.
Every single day. They're just shocking statistics there indeed. There are many silent factors as well that can increase the odds.
Yes, the common risk factors that we know about include high cholesterol, high blood pressure, being overweight or obese, alcohol and smoking. They're the things we know about. There are other interesting risk factors. Having little sleep, less than 6 hours a night, is thought to be associated, and we think that's because of an increase in blood pressure. We also know that migraine sufferers who have aura, so they have associated visual disturbance or weakness, may have an increased risk. People who eat high-fat meals, and a lot of them, have an increased rate of vasospasm, which increases the rate of heart disease as well. And there's other really obscure things like being exposed to pollution, being exposed to the cold, and even an acute exertion like even sexual intercourse has been associated with an increased rate of heart attack.
Yeah, right. Well, you mentioned some factors that are unavoidable: cold weather, pollution, heavy meals and stress. What is your advice for everyone this afternoon?
Well, I think it's important to focus on the preventable things. So make sure that you're eating well to maintain your weight, making good dietary choices, regular moderate level exercise, of course not smoking, reducing your alcohol, and getting a check on things like your cholesterol, your blood pressure, even your blood sugars with your GP. Those over the age of 40 should be getting a heart screen, whether or not you're a woman or a man, with your GP, and being mindful of your family history. If you've got someone in your family who's had a heart attack, a stroke, get checked out by your GP to know what your risk factors are.
As always, good advice, Dr. Tamara Hunter. Thank you very much for your time.
Thanks, Tracy.